Results from the 2014 HIV Sero Survey report show a stagnant trend in prevalence rates of HIV infection, currently at 7.3% countrywide. According to the Ministry of Health, about 1.2 million people are living with HIV, and many cases of new infections are being registered, especially among teenagers. The ministry has since employed various methods to reduce the infection rates of the epidemic, which include campaigns like 90-90-90. The ambitious campaign seeks to have 90% of the people living with HIV know their status by 2020. It also intends to have 90% of those diagnosed with HIV to receive antiretroviral therapy, and finally 90% of all people on antiretroviral therapy having an undetectable viral load. International donors and the government have over the years invested a lot of resources to have antiretroviral drugs available to poor people living with HIV. But despite the large inflows of funds to Uganda for HIV and AIDS, a 2014 UN AIDS report indicates that of the estimated 1.2 million people living with HIV and AIDS, about 150,000 need antiretroviral treatment, but only 67,000 are accessing it. Amuru is one of the Ugandan districts that has a shortage of antiretroviral treatment drugs.
From June to August this year, we were having issues of stockouts. We were running from facility to facility to go and borrow.
Dr. Pontiano Kalebu says such inconsistencies are the cause of drug resistance.
And resistance to these drugs need to be prevented. People have to adhere to the drugs. If you don't adhere to the drugs, then you develop the resistance, and resistance is being transmitted. If we do that, it will mean that many of our people will start getting infected with resistant viruses that are not going to respond to our treatment.
This year, a report from the World Health Organization states that the consequences of having HIV drug resistance include treatment failure and further spread of drug-resistant HIV.
The viruses we are seeing now are what we call recombinant. We used to have, in those days, 10, 15 years ago, we used to say, in Uganda we have HIV subtype A and D mostly. But now, most of the viruses are recombinants. It's a recombination of these viruses. And that could, we don't know the consequences. It could lead to some issues on vaccines and treatment.
This can compromise the effectiveness of the limited therapeutic options to reach the last 90 target of achieving virus suppression and further reduce HIV incidence, mortality and morbidity.
In Uganda, we still have low transmitter resistance, but in Kampala, we have found moderate transmitter resistance, So, as we go along, and as time increases of the time we have been using antiretrovirus, we worry that resistance may increase, but we are doing all we can to prevent that. Now, the problem will be if we have a lot of people who have transmitted drug resistance, it means our drugs are not going to work. Our patients may need to use second line or third line, which are expensive and difficult to get.
The nursing officer at Otwe Health Center 3, Agnes Lanyero, says shortage of medical workers has also affected the HIV services at the health facility.
They come for CD4, but the problem is the lab personnel. You find when at times he could not be there at least. So we cannot blame him for that. I'm not blaming him because he cannot work from Monday to Monday, Monday to Monday without resting. So at times when they come, we do tell them that the lab personnel is not there. So they end up not taking their CD4 or even viral load. For us, for maternity, we serve our mothers differently from our clinic here. And it needs a midwife to be there all the time, especially during the hard day. And there are only 2 midwives, and now one has gone for annual leave, then the other one is a district mentor. And if she's not there, who is going to work in maternity or with those mothers?
Drug ideally is supposed to be supplied according to the order you have made. But like we have received the drug on the 8th this month, it is varying from what we have actually requested. So I am in the process of trying to contact the higher office and find out why the discrepancy.
So many of our colleagues have registered complications because of the inconsistency, and this sometimes is not what they wish to do, but sometimes it just happens because you have gone to a facility and there is no medication.
The head of communications at Nafofanu, Dorothy Nasolo, urges the government to increase funding for antiretroviral treatment to curb the danger of drug resistance.
I call upon our government to prioritize HIV funding. We need to lay strategies of seeing that HIV is eliminated, and one of the ways is to look at treatment as prevention.
Currently, World Health Organization is developing a new 5-year global action plan for 2017-2021 to support a coordinated international effort to prevent, monitor and respond to the emergence of HIV drug resistance and to strengthen country efforts to achieve the global HIV targets. Walter Mwesije, NTV.
Thank you.